Hi, good evening friends. I am Dr. Sumit Mrig. I am Head of ENT and Director at Max Hospital, Saket. Today we are going to talk about one of the most Googled topics, vertigo, chakkar. Vertigo is a sensation when a patient feels that he is revolving around the environment or the environment is revolving around it. So, vertigo is a feeling of rotation and it is a symptom which the patient feels. It is actually not a disease, and you have to understand that the symptoms can be because of many reasons, and we need to identify that cause and treat it accordingly. Depending upon its onset, if somebody is having acute vertigo and reaches an emergency, then maybe yes, vestibular suppressants are the main treatment till you diagnose the etiology. Based on the etiology, there can be rehabilitation medicines, there can be rehabilitation therapy. Stress can be a very strong contributing factor, especially in the current generation. We are always on screen time. Increase in the screen time can cause a problem, an etiology, what we call as vestibular migraine. Too much of tea, coffee, stress, poor sleep, poor dietary patterns, lack of exercise, all of these can lead to vestibular migraine and can cause vertigo. Generally, vertigo incidence and prevalence is seen definitely in women, which is a little more than what we see in men in our routine OPDs, and that can be contributed to many factors, which is hormonal status, stress factors, poor sleep, which is generally more common in women. Many a times we get patients in our OPD who have seen multiple doctors in their clinics, which include physicians, which include paramedics, which include orthopedic surgeons, spine surgeon, neurologists, neurosurgeon, physicians. The most important in the treatment of vertigo is to establish a diagnosis. Many a time we have multi-canal involvements in cases of the positional vertigo, and sometimes when we are not able to establish a diagnosis, I would love to have these patients undergo what we call as vertigo profile. So this profile takes care of all the dynamic and the postural behavior of the body. Actually, the ear, the spinal cord, the eyes and the brain, all of them coordinate to give you balance. And one of the organ, if doesn't work properly, gives you a sense of imbalance or a rotational feeling. So sometimes these tests do give you a lot of help in pinpointing to a diagnosis and treating vertigo. This is whenever you get a feeling of rotation, whenever you have any episodes of vomiting along with the rotational movement, you have sudden hearing loss, you have sudden buzzing of noise in the ear, I think then it's a medical emergency where you should see the ENT doctor.